Hello friends, I am Dr. Ajit Kumar Rawat. Today we are going to demonstrate how to identify the different liver segments with the help of endoscopic ultrasound. So we are going to use the EUS ME3 scope from Olympus. So the patient's position is in the left lateral position, and it is same as we do in the routine endoscopy. And the scope insertion procedure is same as we do for the duodenoscopy. So is sedated. Take this. Patient is sedated, and we are going to introduce the EUS scope. So, like before insertion, one should keep in mind that the probe end of the scope is little bit longer than the routine ERCP scope. So the insertion should be gentle, not forceful, and the movement of the knob, the up and down knob should be towards the down, so that we get the curvature of the uh, pharynx. So patient is quiet and sedated. So we are going to insert the scope, and insertion of the scope is exactly the same as we do in the ERCP procedure. Gently pass the scope across the upper esophageal sphincter. So we are now having the endoscopic view. Now as we reach the GE junction of the patient, we will turn on the sonar view. So before describing the liver segments, one may start from the left lobe of the liver, like this one, or you can start with identification of the IVC. So for the beginners, it would be like easier to start with the inferior vena cava, where all the three hepatic veins converge and meet. So friends, like we will start with the finding the IVC. Yeah, here. So you can see we have got the IVC. IVC is right here, and it is little bit kinked in the intrahepatic portion. See, this is the dilated portion of infrahepatic abdominal compartment. This is suprahepatic compartment. This is the intrahepatic compartment, in which the IVC is little bit narrowed. So in this narrowed segment, the first vein to identify is the hepatic vein, right hepatic vein. So this is the right hepatic vein we are finding. Yeah. Over here is the right hepatic vein. How do we identify the right hepatic vein? This is the right hepatic vein. Right hepatic vein has got a has got a maximum caliber when it gets inserted into uh, the IVC, and gradually it tapers down. And moreover, you won't find the ligamentum venosum over here, which is a bright white band, which is seen when we actually trace the middle hepatic vein. So this is the right hepatic vein. The liver segment, which is away from the probe is the segment 7, and the segment which is towards the probe and above the right hepatic vein is the segment 8 of the liver. So this is the right hepatic vein which is getting inserted into the IVC, beautifully seen. Its diameter is gradually decreasing when it is going into the liver, maximum when it gets inserted into the IVC. Now with this anti-clockwise torque we move and we will find a middle hepatic vein. See, this is the middle hepatic vein, the point where the arrow is pointing. Yeah, this is the middle hepatic vein. The segment which is away is segment 8. The segment between the middle hepatic vein and this bright red band is the ligamentum venosum. The segment of the liver which is between the ligamentum venosum and the right middle hepatic vein is segment 4A, and the segment which is above the ligamentum venosum and the beneath the IVC is segment 1, that is caudate lobe. So this is segment 1, 4A and segment 8, 1, 4A, 8. So this is beautiful demonstration of the ligamentum venosum. One more thing, this ligamentum venosum unites the IVC. It is actually a ductal remnant of ductus venosus. It unites the IVC and to the umbilical portion of the left portal vein here. The another band which is connecting the umbilical portion of the left portal vein and extending away from the probe is the ligamentum teres, which is actually the continuation of the falciform ligament, in which the left umbilical vein runs in the fetal life. So this is the beautiful demonstration of the ductus ligamentum venosum, the umbilical portion of the left portal vein and the ligamentum teres. Now further anti-clockwise movement would bring the left portal vein into the picture. This is the left portal vein. This is the left portal vein. The liver segment which is above the left hepatic vein, the segment which is above the left hepatic vein is the segment 2 of the liver, and the segment which is away is the segment 3 of the liver. So this is segment 2, segment 3. So one more segment we can identify over here is the, yeah, here you have the distal most, it is the segment 4B, segment 2, segment 3, segment 4B. So identification of the segment 2 is important because like when there is obstructive jaundice and the biliary reticles are dilated and you are not having the access through the papillary orifice, you go to the left lobe intrahepatic biliary radicals, and segment 2 is most appropriate for the antegrade stenting of the bile duct, or while putting the antegrade biliary metal stenting, or for the rendezvous procedures. So and the segment 3 biliary radicals, they are more appropriate, they are deeper, they are more appropriate for the hepaticogastrostomy. So left hepatic vein, segment 2 above, segment 3 below, and 4B at the distal most part of the segment 3 here. This is segment 4. This one segment 4B. So this is like how you go about examination of the liver segments from the cardiac end of the stomach, and you describe the segments 1, 4, 8, 4A, 4B, segment 2, segment 3, and segment 7. So remaining segments like the segment 6, segment 5, uh, they are better defined from the duodenal aspect. So we will move the scope into the duodenum. Yeah. Yeah. The structure which is very close to the yeah, probe is the portal vein. This is the portal vein. This is the portal vein. So what we are going to do, we are going to trace the portal vein into the intrahepatic course. This portal vein divert, uh, divides into two. This is done by gently moving the scope anti-clockwise, and your yeah, anti-clockwise, and the up and down knob away from you. Here is the portal vein. We are going to trace it in the intrahepatic portion. The main portal vein divides into the right and left branch. Yeah, here. This is the lower one is the left branch, upper one is the right branch. The right branch again divides into the right anterior and right posterior. So we can zoom over here, and so after we can freeze over. Yeah, see, this is the right anterior branch, and this is the right posterior branch, and segment over here is the segment 5. Segment here is the segment 6. Segment 5 at the distal end has got a segment 8, and segment 6 at the distal away from the probe is segment 7. So 5, 6, 7, and 8. So these are the segments which one can identify from the first portion of the duodenum, that is the duodenal bulb. Again, you see, gently giving that clockwise torque and big wheel away from you, we can identify the segments. So 5, 6, 7 and 8. These are the liver segments from the duodenal bulb. Now furthermore, if the segment are examined from the second part of the duodenum. Here, check out all the areas so that you won't have any artifact, and look for the right kidney. So to enter into the second part of the duodenum, the you should not give excessive force, or else you will perforate the duodenum. By gently moving the angulature across the angulature of the duodenum, you go into the second part, and if need be arise, like you can you can short the scope as you short it in the ERCP. So we are trying to locate the kidney. Yeah, this is the kidney. This is the kidney. This is the kidney. Yeah, this is the kidney, and the segment of the liver which is adjacent to the kidney is adjacent to the kidney is the segment 6 of the liver. So this is segment 6 of the liver. So from the second portion of the duodenum, you can easily identify uh, the segment 6, and all the pathologies, whether be the liver abscess or the metastasis, you can all accurately localize in the liver segment. So friends, in the today's presentation, we have demonstrated the various liver segments. We have examined the segment from the cardiac end, that is the with the help of hepatic veins, and we have located the segment 1, segment 8, segment 7, with the landmark being the right hepatic vein. Then we have proceeded to the segment 1 again, segment 4A and segment 8, with the help of the landmark of ligamentum venosum and the middle hepatic vein. Then further clockwise move, giving the torque to the scope, we move to see localize the uh, left hepatic vein, and with the help of left hepatic vein, segment 2 and segment 3 were delineated. In line with the segment 3, away from the probe was the segment 4B of the liver. Now for the further liver segment identification, we move to the duodenal bulb, where uh, with the help of portal vein, now the portal vein divides into two, the right and left, and the left portal and right portal vein divides into right anterior and right posterior branches. With the help of these right and anterior and posterior branches, we were able to define the segment 5, 6, 7 and 8. So all the 4 segments were also like precisely localized with the from the first part of the duodenum. Now we shortened the scope, went into the second part of the duodenum, where we could demonstrate uh, um, the segment 6 of the liver, which was adjacent to the right kidney. I hope this video was useful to you, and will further help you in identifying the liver segments and localizing the pathologies, and in therapeutic usages like the FNAC or liver abscess drainages. Thank you, friends.